a little bit of a pull right here, okay? Dropping that shoulder. Let it go. There it is. Good job. Oh, that was really well.
I feel like I gave a relief.
So in regards to where you're feeling the pain at, can you show me again where you're feeling it at? So it's kind of more so on this right side here. Mm-hmm. Okay, and then you said the neck and the shoulders. Where do you feel that at? It's like pretty deep down into that mid-back area. Okay, but kind of right into that shoulder blade area?
Yeah.
Okay. All right, well, let's take a look here. Because you said this, you felt like maybe after you had one of your children, like,
yeah, well, because you know how we open up and stuff, and it's all the weight that we carry and stuff.
Yeah, and that's very common. A lot of times during pregnancy or after pregnancy. So during pregnancy, when that baby's growing, and it's putting a lot of pressure and weight onto the pelvis, that can put a lot of stress onto the joints. But sometimes, so right before delivery, you have a hormone called relaxin, and that helps to relax the ligaments, so then that way it prepares the pelvis to deliver. But sometimes the joints can shift out of position. Yeah. But after you deliver the baby, when those joints kind of tighten up again, sometimes they're out of position and they tighten up in the wrong position, and that can set us up for some stress. But even after that, when you're taking care of your child, you know, putting the baby in and out of the car seat, you know, breastfeeding, lifting the baby, you know, so there's a lot of stress that comes after pregnancy as well. Yes. Unfortunately, we just don't ever address some of these issues.
Correct.
Yeah, so, all right, well, let's take a look and see what we're going to be doing. And we're going to go from there. Okay, I'm going to scan you here real quick. So right here, your finder is where you're at. Let's take a look here. Alright, so we definitely have some stress on that mid-back. It makes sense why you're feeling some of that stress on that shoulder here.
I feel the pressure on there.
Let's see how we're going to look at the lower back. A little bit of pressure right there too. Yeah, that's where you're seeing a lot of the compensation starting to occur in that lower back. Yeah, now that we got those x-rays, it does make a little bit more sense about what's going on. So let's take a look here. So I'm going to put some pressure onto the spine. You feel any pain or soreness, let me know right away, okay? Here's C6, C7, 6, 7. Any pain there?
The 7.
Right there, yeah. Yeah, so this one moves really well, actually. C6, 7, that's where you're, that's really stuck there. 1, 2, 3. Here's 3. Ooh, right there. 4, 5. How's 4 right there? Slower? Yeah. Yeah, you can even tell just there's more fluid around that joint, so it's more poofy. So when I push in there, you can tell it's just a little more swollen. Relaxing this one. A little bit of pop in there. Yeah, right there. You got some stress there. This part is right where you're seeing on the upper part of that, where it kinks to that, right? We might adjust this. We're gonna see, but let's take a look at that lower joint right here.
Oh yes.
You feel that already? Yeah. So here's the upper joint, middle, and then the lower. Upper, middle, lower. Any pain on those?
The middle.
The middle one right there? Yeah, so that makes sense because your pelvis, what it's doing is on the x-rays, it's showing that it's externally rotating. As it externally rotates, it opens up that joint and you're going to see a lot of swelling right in the middle there. Okay, take a look at the left side just to see the movement here. Oh yeah, that moves way better on that left side. Yeah, so we're going to work on this right side and see if I can get some pressure off of there. So because it's rotating out like this, we're going to see if I can pull that and grab it and pull it in this way, okay? But let's first do your neck. We're going to do C7, we're going to do T4, and then we'll get that right hip. We might work on this later on, but we're probably going to not work on this. It's not as big of a reading as the other ones here, so let's see what that does. Now, I'm going to give a little bit of a push. You might hear a little bit of popping noise, okay? That's just some gases in the joints getting released. Relax in there, and there it is. Good. Good, there's a little bit more. Let's see if I get a little more on that left side. And then that should be good. We'll get that lower back in just a second here. Good, relax in there. There you go. There's the rest. Okay. All right, you doing okay?
Yes.
All right, good. Lifting up, then relax. Almost there. One more time, lifting up. There you go, and relax. There you go. All right. So from here, you're just going to relax that shoulder and a little bit of a pull right here, okay? Dropping that shoulder, let it go. There it is. Good job. Oh, that was really well. How's it feeling right now? Any difference? What are you feeling?
Yeah, I felt good.
Good. One more time. And what are you noticing right now?
I feel like a relief, like if I was carrying something and it
You just let go.
yeah.
Breathing in. Let it go. Dropping the shoulder. Nice. Ooh, good job. Which part? The mid?
All of them, but
Okay.
like the mid, I felt like I had so much pressure, like there, like stuck.
Yeah.
So like,
Good. All right, let's see how we did. Let's have a seat right here facing this way. Yeah, no, we got some work ahead of us, but I'm glad that we started the process, get some pressure off of those joints. And then the movement, the walking, that's where you're going to start to see a little bit more change, because this is just the beginning process.
yes,
When you go out of here and you get movement, you get some walking,
yes,
that's where the process continues, because we're just starting it. I always tell people it's kind of like we get like a key and we unlock the spine.
yes,
And as it unlocks the spine, the movement, the walking, yeah, it's much better. The movement helps the process to continue to allow the years and years of just compensation. It just relieves a lot of that pressure. Yeah, it's better. The first thing, we did the lower part of your neck here.
yes,
So that's your C7 here, okay? So 1, 2, 3, 4, 5, 6, and then 7.
yes,
We're pushing that spine forward because I'm trying to get curvature coming out. So unfortunately, a straightening of the neck is becoming more common just because of our culture. We're heads down like this on the phone, we're on the computer a lot. So it's becoming more common. So we see this a lot, but we're trying to push that spine forward to get curvature coming back in a little bit, okay? The second thing we did was your pelvis here. So this listing here, we said it's AS8, EX5. So what that means is your pelvis, like I said, it's shifting forward and then it's
Yes.
rotating out. When we go underneath, I'm pulling that down and I'm also pulling it in, okay?
yes.
So we're getting movement into that pelvis to get pressure off of that joint. So again, walking, that's gonna help to push out some of the inflammation here, okay? The last thing that we did was your mid-back, and that's gonna be right into the center of your spine, right up here.
Yes.
So there's some stress here. We're going to need to work down below a little bit later, but today we just worked on the mid-back, the neck, and then the lower part of the spine as well, okay? So, like I said, walking is going to be a big part.
Okay.
Ice is also going to be your best friend. So if you feel any soreness, any achiness, it can be expected because as we get those joints to move, it's been this way for what I think you said it was like 15 years. Or, yeah. So when we move those joints, your body's been this way for a long time, so it can get a little sore because your body's like, oh, this is different. Yeah. So when we move those joints, just know ice, you can do 10, 15, 20 minutes every couple of hours. Just get an ice pack, put a paper towel around that, and ice wherever you need to, okay? So ice, and then getting some walking, 15, 20, 30 minutes, whatever your body can do. And then as you continue to get movement, we should see some more improvement with the joint as well, okay?
Perfect.
Any questions from you?
Thank you so much.
Yeah, well, thank you for being here. Yeah, I'm excited that you're here.